Good afternoon, everyone. Today, we will be discussing advanced topics in medical assessment and evaluation specifically focused on pediatric patients. Throughout this session, we will cover a range of complex topics, providing detailed information and insights on each. These topics include assessing and interpreting complex developmental milestones, evaluating the neurological system, managing congenital disorders, pharmacological considerations, advanced cardiac auscultation techniques, genetic evaluation and counseling, emergency assessment and triage, respiratory system evaluation, rheumatologic assessment, psychosocial assessment in chronic illness, childhood cancer symptoms assessment, and advanced techniques for assessing child abuse and neglect. Now, let's dive into the first topic. In this segment, we will explore the assessment and interpretation of complex developmental milestones in infants, children, and adolescents. This includes assessing and evaluating fine and gross motor skills, language and communication abilities, cognitive development, and social-emotional growth. We will discuss the various standardized tools used in this evaluation process, as well as the significance of milestones in identifying potential developmental delays or disabilities. This topic delves into advanced techniques for assessing the neurological system in children. We will cover the cranial nerve examination, motor and sensory evaluation, reflex testing, and coordination and balance assessment. Understanding these techniques will enable medical professionals to obtain comprehensive information about a child's neurological health, identify any abnormalities, and plan appropriate interventions. Here, we will discuss the evaluation and management of complex congenital disorders in pediatric patients. This includes genetic and chromosomal abnormalities, structural anomalies, and multisystem involvement. We will explore the diagnostic tools and imaging modalities employed in assessing these conditions, as well as the treatment options available for each. The unique considerations for prescribing and administering medications to pediatric patients will be the focus of this segment. We will delve into dosage calculation, age-appropriate drug selection, and monitoring for adverse effects. Understanding these principles is crucial in ensuring safe and effective medication management for pediatric patients. Mastering advanced cardiac auscultation techniques is vital in assessing heart sounds, murmurs, and abnormal cardiac findings in pediatric patients. We will explore various techniques, including phonocardiography and echocardiography, to enhance diagnostic accuracy and improve patient outcomes. Understanding the principles of genetic evaluation and counseling in pediatric patients is essential when dealing with genetic disorders or family history concerns. We will provide guidance on genetic testing, inheritance patterns, and family planning, enabling medical professionals to support families through informed decision-making. Developing skills in rapidly assessing and prioritizing pediatric patients in emergency settings is crucial. This topic will cover recognizing life-threatening conditions, determining appropriate interventions, and collaborating effectively with multidisciplinary teams to ensure the best outcomes for critically ill children. This segment will expand knowledge and skills in assessing respiratory function in pediatric patients. We will explore various techniques for evaluating lung sounds, measuring oxygen saturation, and interpreting diagnostic tests. Emphasizing the importance of accurate assessment in managing respiratory conditions will be a focal point. Advanced assessment and management of pediatric rheumatologic conditions will be the focus here. We will discuss conditions such as juvenile idiopathic arthritis, systemic lupus erythematosus, and other autoimmune disorders, exploring diagnostic criteria, treatment strategies, and multidisciplinary approaches for optimal patient care. Chronic illness impacts not only a child's physical health but also their psychosocial well-being. This segment will comprehensively evaluate the psychosocial impact of chronic illness in pediatric patients, including assessing coping mechanisms, quality of life, and mental health outcomes. We will explore strategies to support patients and their families throughout the care continuum. Recognizing and evaluating the signs and symptoms of different types of childhood cancers is crucial for early detection and intervention. We will discuss principles of cancer staging, various diagnostic approaches, and collaborative efforts with oncology specialists to ensure comprehensive care for pediatric patients with cancer. Mastering advanced techniques for recognizing and evaluating signs of child abuse and neglect is vital for healthcare professionals working with pediatric patients. We will delve into thorough physical examination, documentation, and collaboration with child protection services to ensure the safety and well-being of vulnerable children. With these comprehensive topics covered, it is evident that advanced pediatric assessment requires a multidisciplinary approach, incorporating medical, psychological, and social perspectives. In conclusion, by delving into these advanced topics in pediatric assessment and evaluation, medical professionals will be equipped with the knowledge and skills necessary to provide comprehensive care for pediatric patients. The mastery of these techniques will contribute to improved patient outcomes, effective treatment plans, and enhanced collaboration within multidisciplinary teams. Thank you for your attention, and I encourage you to actively engage in discussions and ask questions throughout this session.